right, we're back with Consumers for Quality Care board member Jason Resendez answering your healthcare questions. This person says, I have Humana Medicare and I haven't heard from my agent. Does that mean that my plan will stay the same and I will be getting my new card for next year?
So it doesn't mean that your plan will stay the same. It does mean that if you don't make a change, you automatically be enrolled. But I'd say if you want to be certain that there are going to be no changes to your plan, I would definitely be persistent in talking to your agent and calling Humana directly to ask questions to make sure that there are no changes to the plan. But you'll automatically be re-enrolled unless you want to make a change.
And of course, the Medicare enrollment is a little bit shorter. That ends like next week, so you'll want to make that call soon. All right, this next question is, did you say that Medicare will cover anything related to COVID? Let's clarify that.
Yeah, definitely won't cover everything. What we've seen as it relates to telehealth services, it's more likely to have your telehealth copay waived through Medicare compared to a lot of private insurance plans, which we've seen start to reintroduce copays for telehealth services. So it's still important to verify what's being exactly covered.
Yeah, and that's for all of us, Medicare or with your regular plan, to know. Just because last year some of those COVID tests and things were covered doesn't mean that going into this next year that's going to be covered. So you'll want to ask. All right, this next question is, if I don't have to do anything unless I want to change my health care. Is that correct?
That's right. You'll automatically be re-enrolled into your existing plan if you don't make a change. At the same time, we really encourage folks just to look around on the marketplace, look at what your employer is offering. This is a good time to reevaluate. You might qualify for subsidies this go around that you didn't last go around, and you might find a plan that's just as good but might be cheaper, and it all comes down to shopping around.
Right, because the plan, you may love your plan from this year and you just hope that it continues next year, but your plan next year may be tweaked just a little bit, and you don't know that unless you ask. Okay, let's talk about what junk plans are. What are they, and how do we need to be able to recognize them?
Yeah, so junk plans are short-term limited duration insurance plans. These are plans that look great on paper because they have low monthly premiums, but they often come with high deductibles and also often exclude pre-existing conditions. In some cases, things like even pregnancy and common heart conditions. So watch out for the term short term when you're shopping around for a plan, because this is a lot of the surprise bills we've seen have come from short-term limited duration plans where folks think, oh, I have health insurance, I'll go get covered. But a lot of those basic services are excluded through junk plans. And so these are really something to watch out for. Okay,
so if you hear the words short-term, that means that you're not getting the regular health plan through the enrollment through the marketplace.
Exactly. You want to watch out for that term, short term, and as much as you can, and understand exactly what you're signing up for.
Okay, and so that leads me to this. There are so many plans, and so often we look at those websites and our eyes just kind of glaze over. How are some of the best ways to kind of filter through to find out what's really best for you?
Yeah, I think healthcare.gov does a great job of allowing you to do side-by-side comparisons. So I definitely take advantage of that, but know what you want to rely on. So if you rely on telehealth, that your preference is telehealth, if you have a specific network or provider that you want, use those as a lens to help you think about and evaluate these plans. And I think that side-by-side comparison tool is really helpful for that.
All right, and this person says, what's the first step for someone who's turning 26 in January in 22? So if they're going to be off their parents' insurance, they can start it in January. They can enroll in January for February, right?
Yeah, that's right.
All right, that's good. All right, Jason, thank you so much for joining us and for getting all those questions in. Thank you for sending in your questions. If you missed anything, you can always look in the 2 Wants to Know section.